mid-1900s, constraint-induced therapy research was first done on monkeys with unilateral lesions in their brain causing hemiplegic presentations of motor deficits. The monkey's uninvolved upper extremity was immobilized, and task-oriented training yielded lasting changes in motor strategies to increase function in the involved side, as well as improvement in concurrent bilateral hand function. The scientists found that other areas of the brain took over and compensated for the deficits caused by the lesions, resulting in plasticity of the brain and overall improvement of function. In the mid-1900s, research began on human subjects to determine the effects. In 1987, research was done by Dr. Edward Taub and the research group at the University of Alabama at Birmingham on human subjects. Dr. Taub and his research group developed training programs for upper extremity recovery in adults recovering from stroke and children with hemiparesis. Emphasis was on task orientation, behavioral techniques, and concentrated on repetitive practice and other characteristics. Research found that constraint-induced therapy was also effective in humans.
Hey Becky.
Hi Sue.
I was wondering if I could ask you a few questions about a patient that I just referred to for therapy.
Sure, go ahead.
Well, I was wondering if he would be a candidate for constraint-induced therapy.
What's his presentation? Have I seen him before?
You actually have. His name is Derek and he is 4. He presents with hemiplegia, and I heard he could possibly qualify for constraint-induced therapy due to this presentation.
Well, given the current research, constraint-induced therapy is the gold standard for treating children with hemiplegic cerebral palsy.
Okay, Derek really wants to play t-ball with his friends, but he's having difficulty gripping the bat and bringing his arm around and extend his elbows to finish his swing. Do you think this treatment could increase his function and let him play?
Being a certified clinician in this area, I do believe that Derek could benefit from constraint-induced therapy.
How does this treatment work?
So constraint-induced therapy helps to facilitate a plastic change to learn how to perform activities with his right arm and hand, with his left arm being casted. So his left arm will be casted from his upper arm down to his fingertips, so he can't use it to assist with the activities.
Okay, how long will his left arm be casted?
He'll be casted for 4 weeks.
And what will his therapy look like?
He will attend therapy for 3 hours every day, and during the treatment sessions, I'll work in conjunction with his occupational therapist. His treatment will consist of a multitude of activities which would improve his grasping patterns, his reaching patterns, and many other activities. Carol is the occupational therapist in this clinic, and she has a break right now if you want to ask her a couple questions.
Sure, that'd be great.
Hey Carol, you got a second?
Yeah, sure, what's up?
So Sue has a few questions about constraint-induced therapy about a patient that she referred to us.
What do you want to know?
So, is there any benefit to combining PT and OT to target fine motor skills with CIT?
Yes, patients who typically are receiving the CIT not only have difficulty with gross motor skills, but also with fine motor skills. Most of these individuals are using the uninvolved extremity to complete all of these tasks. So the goal of the CIT training is to cast the uninvolved side, so these children start to work on performing the task with their involved extremity. And for children that might become discouraged or self-conscious, there is more of a group-based alternative. There are summer camps. The time frame varies, but the goal is all the same. It's an encouraging group atmosphere, and the goal is to improve the function in everyday activities.
Okay.
Certification is not mandatory to treat patients with constraint-induced therapy. However, the University of Alabama at Birmingham offers a constraint-induced therapy training program that is designed for physical therapists, occupational therapists, physical therapist assistants, and occupational therapist assistants with a desire to develop constraint-induced therapy programs in their clinical setting. This course will focus on constraint-induced therapy treatment for upper extremity rehab for adults with chronic stroke and children with hemiparesis with mild to moderate impairments. While the training is primarily designed for clinicians, it may also be appropriate for scientists wishing to conduct constraint-induced therapy research. Participants should enter the program with a basic understanding and competency with physical rehab strategies for patients recovering from neurologic injury. The course is 5 days long with a conference rate of $900, which includes admission to the training program and the training program manual.